Tell me how your back's doing and how's it?
Back is okay. I mean, still on the stiff. Like when I go down and pick things up, I have to slowly do it.
Okay.
You know, because I feel like almost like a sharp pain that it's about to start. So I just kind of, you know, use more of my legs, and I find myself like ooh. So I just kind of take it slow.
This is Edwin's third visit, and currently the treatment protocol I've been applying to his case has not been increasing the amount of time that he can sit. I want to change strategies today and see if the new strategy has a greater impact on his low back pain.
Or if I'm sitting down long enough with the client, because I see clients, you know, 15 minutes.
So during his initial exam, we noticed that he has lower body weakness. This is abnormal. He should have strength.
Okay. Yeah. Try the stiffness.
All right, let's do something different today. Then. Push up. Try this push out for me.
And try again, push up.
What position bugs your back?
When I'm sitting, bugs my back. When I'm sitting.
What I'm doing here is checking that if I just C0, a C0 joint, which is his occiput on his skull, what happens to his cross-chord reflexes in his lower extremity.
Kind of like, for some reason, automatically just I have to do it slow. Maybe it's just more a mind thing.
So here I'm going to adjust the C0 joint, and the C0 joint is the skull sitting on top of the atlas. And if we look from the top down upon the atlas, these are the facets that we're going to attempt to stimulate. Now when I make that adjustment, not only am I going to stimulate the joint, I'm also going to stretch the muscles around the C1 joint from the skull to the spine. And the purpose for this, the theory is that when this joint is out, that the psoas muscles do not fire properly. And the psoas muscles are the only muscles that go from the upper to lower torso in the body, and they insert into the legs. And when this muscle doesn't fire properly, it can cause low back pain.
But
so after making that adjustment, I'm going to go do some trigger point work along the muscles in the attempt to simply restabilize their firing sequence to see if we can modulate those muscles to decrease low back pain.
I want to see how you feel, and I'd like you to sit for a little bit once you're done walking. Mm-hmm. How do we know if your back's better after your treatment? Do I have to have you sit for a little bit, or what do I have to do?
well, I mean, because like after this, I'm going to work. Like usually after I go to work and I see clients, and then I'm sitting.
How long does it take to sit for your back?
In a few minutes, I'll start like feeling like kind of discomfort with my body automatically just start kind of moving because I could just feel like the stiffness, then just a little bit painful. So I'm doing this, just trying to move it. And then when my clients are done, I give myself like 5 minutes. I really just stand up and stretch and
do this on your side. Face me.
When we're performing low back adjustments, we have a long lever and a short lever adjustment. I'm going to perform a short lever adjustment bilaterally on this patient at L5. Short lever adjustments are better for the patient. They're harder on the doctor. Long lever adjustments are easier on the doctor, a little less beneficial to the patient. They're more general versus the short lever, which is more specific. All right, so one of the other muscles that gets neglected a lot in low back pain is the quadratus lumborum. In here, I'm going to do trigger points at the ridge where it attaches to the pelvis, the middle of the body, and the portion that attaches to the lower rib. You can also see in the diagram that attaches to the entire spine.
How are you getting any clients?
I'm sorry?
How are you getting any clients?
They find me on psychology today.
Is it safe to get it?
Well, word of mouth.
Oh, okay.
All right, go walk. Try that.
Okay, George. Yes. Okay. And you want to reschedule for when?
How's that feel?
This week.
Yeah.
Is she down with the?
I want you to sit for a little bit and just see if it bugs you right away, if it takes a minute or two, like what's the...
Oh, okay.
Anywhere?
Anywhere.
You want us to reschedule for Thursday then?
All right, so it's stiffening up. Where at?
Here.
Let's do this. I want you on your stomach.
So what I'm going to do is isolate the Illiolumbar ligament. In some patients, this can get really tight, also causing back pain. So I'm going to go in with my elbow initially to see if I can make some change. That space is really tight, so sometimes it's better to use an instrument.
Try sitting again, just see anything, if that makes any change. Did it change it kind of or no?
Yeah. I mean, I still feel like semi-stiff, but I don't feel like that stiffness.
On your stomach again.
It's okay.
All right, you should sit again. I know. Actually, walk first, just a little bit, and then sit for a little bit. So, tell me what's going on.
I went to my doctor the other day.
Okay.
So they did a dry needle trigger point injection on me.
How'd that help?
It didn't. It made me bigger.
Are you, I forget, do we have 8 visits with you?
12.
12 visits.
Okay. And we've seen you one time?
Yep.
All right. You want to sit? I want you to sit for a little bit. Did it change it kind of?
Mm-hmm.
I need you better longer. I mean, I like when you come in, but you know. How's it feel?
Yeah, I mean, I don't, right now I don't feel the tightness.
So let's see what this treatment does next time you come in, okay?
Okay.
All right, thank you, sir. Appreciate it.
Thank you.